Hi everyone, and welcome to Let's Just Do This. I'm Margaret Wallis-Duffy, and it's always a pleasure to have my sidekick next to me, Mr. Todd Miller.
Nowhere else I'd rather be.
Well, you know, we love bringing change makers to the table, and we love to talk about innovation when it comes to integrative health. And today we are super excited because we have an amazing guest with us who's returning to the show, as she's been a guest here before. So let me introduce you to her. Dr. Shirley Ha has received her Doctor of Optometry degree from the University of Waterloo School of Optometry and Vision Science. She's a board-certified fellow in developmental vision and vision therapy by the College of Optometrists in Vision Development and is currently pursuing a fellowship with the Neuro-Optometric Rehabilitation Association. She is committed to a lifetime of learning to increase her knowledge base. Dr. Ha is a founding member of the Canadian Optometrist in Vision Therapy and Rehabilitation and hopes to increase awareness of the benefits of vision therapy and vision rehabilitation for parents, educators, and allied health professionals through this non-for-profit organization. She is also on the advisory board member of the Neuro-Optometric Rehabilitation Association in the United States. It is an absolute pleasure to have you with us. Welcome.
Thank you so much for inviting me back.
Yes, well, and we're thrilled that you came back. I mean, the first time you were coming off a plane from Hong Kong. You'd never done this type of television before, and you absolutely crushed it. So you're back today.
It was so fun doing it. Yeah.
Yeah, and you know, one of the things we share is the passion for education and making people aware of their options when it comes to their overall health. One of the things I admire about what you're doing as an optometrist is that you're taking it one step further. And when we're looking at vision therapy today, we're going to jump into what vision therapy can do for sports vision and sports enhancement performance.
Yes.
So many people can be affected by this. So let's talk a little bit. So Dr. Ha, I think it's important for everybody to understand what is vision therapy. Now you're an optometrist, but many people might, you think of therapy, we don't think of it when it comes to our vision. Can you explain to us what is vision therapy?
Vision therapy actually can take your visual process to the next level. I know, when you go to get your eyes checked, you have these machines that tell you what you can see, but vision therapy is beyond the 20/20 eyesight. It's actually, you might have trouble focusing and not realize, or you might have trouble reading, and you don't know why you're having trouble reading, and you're falling asleep when you're reading. You might be clumsy, and you might not catch the ball, which we will kind of talk about later, why you're not able to catch the ball and accurately and fast enough. And vision therapy will give you activities where we can actually teach the brain and guide you to activate your brain to move those eye muscles and make sure that you're performing at your best.
You know, I love that because it's really putting it into action, into the real world, and it's life-changing. Vision therapy can be life-changing. People with concussions, people with children with learning disabilities, coming to see a vision therapist like yourself, who's an optometrist, can be a big game changer. And the same is true when it comes to sport enhancement and sports vision. So let's dive in a little bit more about the impact it can have on sports vision.
Yeah, and I think you are probably as good as what your eyes can do in sports.
Indeed.
The Muhammad Ali, I love his quote, float like a butterfly, sting like a bee. You can't hit with your hands what you can't see.
Right.
And that is just, for me, that tells me about what I do, not just in sports, but in everything. Yeah. So not only do you have to be graceful in your movement, but you need your eyes. The premise is the visual system actually leads the motor system. And it's an acquired skill. You learn it from experience, from all your experiences in life. And it's what you do with how you interpret the information that you see. What do you do with it?
Right.
But you need to be able to get the information in before you can have motor output. So in sports vision, this is where you take it up to the next notch, let's put it that way.
Right.
In general, the basic skill set, they say there are about 17 visual skills, and people think, wow, that's a lot. But in sports vision, I would say double that.
Really?
Yes, because it's not just, like I said before, even vision therapy doesn't deal with just 20/20 eyesight. The glasses that you get, yeah, that's important, you need to see, but it's not, sports vision is not just about seeing 20/20. It's seeing even better than clearly.
Right.
Funny you mention
Yeah.
that, because I would, as a layperson, look at that and say, well, there's only really one factor, and it's hand-eye coordination for a lot of these sports.
Ah.
But you're telling me there's way more factors than that.
Exactly, like when you're sitting in the chair in your exam, I'm sure you guys had your eyes checked, you're static. You're sitting there and the chart is not moving. In
Right.
sports, the things you're looking at is dynamic.
Very
So,
different environment.
Yeah, what is your dynamic visual acuity? What about when you're playing a game at nighttime? The contrast might be off. So we need to know how sensitive you are to contrast or not. And what about the speed and timing, anticipation? Where's that ball going to go? I'm going to use the example of a batter. They say from the ball to be released from the pitcher's hand to the base, it's 0.4 seconds.
Yeah, it's
So-
remarkable.
It's
yeah,
funny.
it's 0.4
All of these things that we
seconds.
need our eyesight for,
Yeah.
Yeah.
things are coming at us really quickly.
Very quickly.
Indeed.
And then the batter has maybe half that time to decide where the ball is going to go as soon as it leaves the pitcher's hand.
Right.
And then the other half is figuring out how to get the body movement to hit it at the base.
Right.
So that's why sometimes when you're sitting watching those games, it's like you don't get too many hits because it's harder than you think.
Indeed.
You know,
Indeed.
it's not just hitting the ball.
And this, I mean, is in everyday life, whether you're a little league baseball player or you're
Mm-hmm.
playing, house league hockey. But what is really interesting to me and excites me is the evidence behind vision therapy and the ability to help improve and enhance sport performance for even the highest level of elite athletes.
Absolutely.
It's equally as important for them as well to take their game to the next level.
Oh, yeah, and it can make a huge difference sometimes on their salary.
Yeah. And
I was just going to say, these
true.
people would be paying millions of dollars
Yes.
every year to
Yeah.
perform, and if it's something as simple as they're just not able to focus on the ball, that could play a big role in their,
Yeah.
performance.
An elite athlete or a good champion, they really need to understand their own visual process and know how to use it and know how to improve it.
right.
And it just really, literally, they will have that winning advantage over
Right.
their opponents. And outside of that, I mean, there's so many other skill set. I can tell you, like other ones, like peripheral vision. Many of us don't realize, like just like the soccer player, right? The soccer player, as they're hitting, they need to know where everybody else around them, as opposed to just lasering the ball. Otherwise,
Right.
it puts them at risk for falls too,
Right.
and injuries if they don't see who's coming at them.
Right,
So
exactly.
peripheral awareness is important. Visual memory is also important because you need to know where these players are
Right.
when you're looking around and scanning and doing a lot of scanning.
Right.
So there's so much involved, and you mentioned eye-hand coordination. What about the foot?
True.
Foot pattern coordination as well. That's important,
Right.
and your eyes tell you what to do.
Here at Let's Just Do This, Todd and I really like to bring innovators to the table. And I'm excited this morning because a company called Eyecarrot, who has a system called Binovi, I'm really excited to share with our viewers and our listeners the role that it can play. And I think you brought a clip along
Yes.
for us today. And what I'd like to do is throw to that clip, and then perhaps when we come back from the clip, you could speak to what we were seeing here. And these are different types of athletes doing different types of vision therapy activities on the Binovi system. So if we can roll to that clip, let's take a look. That was very interesting. And clearly different types of athletes. The first thing that comes to my mind as a therapist myself, a massage therapist who works with the physical body, and you know how much I love integrative health, that shows me that vision therapy is combining mind, like brain,
Yep.
eye, and body.
Yep.
We can't get away from it, people.
Yep.
It all works together as a system. Let's talk about what we just saw in that clip.
Sure. What the first athlete, she's actually a gymnast, and what she was doing, you saw that there was 3 units, and she was scanning she was tapping as quickly as possible, just checking her reaction time. But in order to see it, she really has to look at what she's about to hit, remember where it is, and also open up her periphery. If she's jumping off to her right side, she needs to know what light is flashing on the left end and run to it. But you can see she didn't run.
Right.
She was using her peripheral vision and literally just did her little jiggle back and forth and still tap them appropriately.
Amazing.
And timing is important, so she might want to beat her own score and see how quickly she can actually hit those lights. And so that's one activity. The other one, you saw the gentleman that was on the balance board. Sports, it's all about balance. So imagine a basketball player who is actually in doing a little bit of a twist, more weight on the one foot, and still hit that ball as he's turning and twisting his body.
Yes.
So it's kind of that concept. With the Binovi system, with their units, you can use it physically, and then we can actually load it up even more by putting glasses on them that distort their view, and blow that up. So that was kind of cool. And also there's another one where the physio, the athlete was on the physio ball and she was tapping. That was also building core.
Yes.
Core is so important, core strength. And the Binovi touch system allows you to have that flexibility. And the clip doesn't have another unit where they actually have an iPad, and these lights, when they flash, there are actually numbers that they can pop up, and you can actually do focusing here and focusing down there for like a tennis player.
Right,
For example.
right.
Wow.
You know,
Different
so
focal lengths.
Different focal lengths.
Yeah.
You can actually move up or move back, or you can do this. You can pull your arm out and forward, and everything is dynamic.
Very
so
cool.
it's really
Wow.
cool. Yeah.
Well, we've got so much more to share, but we're going to need to take a short break. So stay with us because we'll be right back just after the break with more with Dr. Ha and sports vision therapy. Stay tuned.
Welcome back to Let's Just Do This. I'm Todd Miller, along with Margaret Wallis-Duffy and our great guest, Dr. Shirley Ha. Here at Let's Just Do This, we love to give our viewers and our listeners practical tips so that once they're finished watching the show, they go away and apply all this wonderful knowledge they're learning. Can you talk about eye protection and how important that is and provide some tips around that?
I see way too many, and that's why I think every athlete should have some form of eye protection, headgear. Even if they need to protect their body, they should. Visible eye injuries could be a retina that's detached, and that's totally vision threatening.
Yes.
The other minor ones, but it's still a nuisance because they'll have to take time out, would be corneal abrasion. Imagine getting scratched by a fingernail or something like that. That's not very pleasant either. It's actually very painful. And stuff like that. Those are visible. And of course, the bruising, the orbital fracture, you don't need that. That's also very dangerous. But many people don't realize there are also invisible injuries. And it's your mild traumatic brain injury or concussion, the concussion world that's out there, the concussion word that's out there. And these are patients who are photosensitive. They don't like crowds. They're very visually, they're totally, they have sensory overload. So they don't like people mulling around. They can't even work on the computer. They have blurry vision. They have double vision. But they look fine on the outside.
Right.
Their MRI is okay. All their scans are fine. But they're suffering. And it can be mentally draining too. Many of them become recluse. They don't go out of the house. They're depressed because no one believes them because they
That's
look
right.
fine.
It's invisible.
Yeah.
And that's the society and the system that we currently work in, isn't it? You know, we have to look sick enough
Yeah.
to get the attention. However, quality of life and preventative and integrative care is not in the priority.
Yeah.
Yet we see in our practices every day, Dr. Ha, that people aren't living well. They may be living longer, but they're not living well.
Yeah.
And what you're saying, which I love, is what about the quality of well-being
Oh, yeah.
and the longevity, and we don't want to be here to suffer. And when it comes to sports vision, as you said, these are people that are dedicating their life to sport, and then an eye injury happens or a concussion happens and it's not properly paid attention to, it can be devastating to them mentally, physically, emotionally, and spiritually.
Absolutely. And that's where I'm going to bring back sports vision and even vision therapy. By using your visual process better, you actually protect yourself from having injuries to your own self, no
Right.
matter what age, like even a senior, even though we're talking about sports vision, but even a senior, knowing how to use their visual process, they're at less risk for falls.
Right.
Yeah.
You know, and that's so true. I mean, to really look preventatively, which, you know, at all ages and stages. I mean, we all have to move to live.
That's right.
And when our eyes are not functioning with our body, like you said, you're at risk of falls, which can be very, very difficult. When it comes to activities that they can actually do, we always love, you know, the podcast is called Let's Just Do This, because I love to put people into action. I don't like just talking about it. So you brought something along. Can you give an idea of an actual activity that someone could do to make a difference?
Since we were doing sports vision, I kind of brought, this is called the Brock string, but it's got the, you know, your soccer ball, your baseball. I thought that was kind of cute. But it is one of the advanced activities that we do.
Right.
And we can actually, the athlete will have a visual feedback as to where their eyes are looking, pointing, and how focused it is. And because their vision has to be better than 20/20, we want them to see, even like count how many stitches
Threads,
do you
your
see
stitches, yeah.
on the ball. And, you know, so this really gives them a visual feedback of whether or not they're using both their eyes. And
So what would
also-
they do? Tell me what to
Sure,
do.
you want to try it?
Yeah, of course, yeah.
So you put that, just kind of touch your nose there.
Okay.
And let's see if
do I need
Margaret
to have
has
my
any.
glasses on?
No.
Are you sure?
Yeah.
Am I at a disadvantage?
No, you'll be
Okay.
fine. So let's see
So
if
string there, I
let,
can't
let's
see.
see let's see if Margaret has a visual problem,
Yeah.
right?
Oh my goodness.
Remember, this is advanced, so
Right.
So I think you can do this though. So when you're looking at the soccer ball,
Yeah.
how many strings are going into the soccer ball?
How many strings are going into the soccer ball?
Yeah,
One.
one. Can you blink? Go wink, wink, wink each eye, and then the other one, and then
Oh.
open both. Now how many strings?
One.
There's the right answer.
Uh-oh. Okay, that's okay. But you're seeing the ball. So how many strings are going out of the bead, out of the soccer ball then?
Oh my gosh, just one. Should I be worried?
You should, because you're not using both your channels.
Interesting.
Yeah.
Right here on TV.
There you
go.
I'm loving this. No, but this is
We can
this is why
blackmail
we
her,
do
no.
this. Well, how do we prevent things when we don't know things are happening?
Exactly. So you need to be aware, and sometimes it's just awareness that the athlete needs to know, especially when they have a deficit. Maybe maybe they have a midline shift. You know,
Right.
they think their center is here, and maybe they keep hitting that baseball always to left field, even though they had an intention of hitting it like not where it should go. So
Right.
maybe it's their perception. So until they realize it, they can't correct it.
And this sort of testing is not done as baseline then, you're telling us?
No, it's
No.
not. So this is, well, this one, we actually, I can use it as a diagnostic or testing, but I can also use it as an activity. Because the activity itself, the athlete can see what's happening, which eye they're not using.
Wow.
Because when you were winking, what did you see?
It went to one side and then went to the other side.
Correct. But it was, you were projecting one line of sight, you were
Right.
projecting the other, but as soon as both your eyes were open, your brain decided to not use both channels.
Right. Wow.
Lazy brain? I don't know.
Well, you're adapting. You're adapting for whatever.
I'm
You have you
You're
might have a
adaptable.
dominant eye. You might have a, yeah, she's probably a little bit too flexible. But we'll need to make your two eyes team better.
You know what? So this is what I love about what we do on this show, and what I love about getting real.
Yeah.
And you know what? I never stand on a soapbox and say I have it all figured out. I love to learn from people like you, and doing something like that here. I mean, yes,
Thank you
I
for
know I
taking
know.
one for the team. I didn't want to
You
do
didn't
that.
try it, did you?
No.
Yeah. So I have my glasses now because yes, guess what? I need those to read. But you're so
oh, you
right.
know what? You should put on your glasses.
And
and see what
whether they make
happens.
a difference. Well,
Yeah,
we've
that-
got more
they
to
might.
cover about.
Oh, yeah.
It's not about my therapy
Yeah,
here, but
yeah.
it's so interesting to me how we can bring people like you to the show, and immediately the education that's going out there is so, so valuable. That is so cool.
What does nutrition play into eye health? I mean, nutrition as a whole helps our body, but is there anything specific that is tailored towards?
Well, I think we are what we eat. So diet, good nutrition is very important even to an athlete. If they're always having chips and stuff, it's sugar coma in a way, and
Yes.
it increases the chances of inflammatory responses, all that stuff that I'm sure everybody knows about. But with respect to nutrition in sports vision, the University of Georgia actually did a study, and they played with the zeaxanthin, which is a antioxidant. It was 26 milligram of zeaxanthin, and it was a double-blinded placebo study, and for 4 months, what they found was by taking 26 milligram of zeaxanthin, the athlete's reaction time can be increased by 10%, and the way you process the visual information is by 12%.
Wow, that's
So
significant.
That's kind of cool.
And that's significant, period. But in enhanced sports, where to get that competitive edge and advantage,
You're talking
is very-
milliseconds.
Exactly.
Yes.
It's very difficult to do. And so we need to look at all the holistic, and that's what I love about optometrists like you, that really, and I mean, we've had Dr. Teskey on the show many times. We partner with her as well, and certainly looking at all things.
Yes.
And people don't think, well, you know, our eyes and nutrition, really?
Yeah.
But what a difference it makes, and especially when it comes to sports vision.
Everybody's looking for an edge.
Yeah, everybody's looking for an edge. You need the
Absolutely.
proper nutrients to support the body, support, you mentioned physically, emotionally, mentally, like you need the proper metabolites.
That's right.
Yeah.
The fuel. We
Yeah.
need to fuel
Yeah,
our body
exactly.
properly, and it makes a massive difference. Now, one of the things I love in collaborating, and this is what's so blessed to have a job that I do, owning an integrative clinic and being a massage therapist, and people would say, well, how is a massage therapist partnering with an optometrist? I don't massage eyeballs. However, there's something that I introduced you to,
Yes.
the microcurrent point
Yes.
stimulation therapy machine that helps to down-regulate the autonomic nervous system and help to actually retrain the brain. And we're about to do another study on amblyopes, lazy eye, and certainly that can impact sports vision. I love the fact that you're open. Tell us why you're open to these types of things. Coming from a massage therapist who's introduced you, and you're now diving in and caring enough about your patients to do so.
Yeah, well, for me, when I first graduated, I really treated the eyeballs in the chair. That's all I did, until I delved deeper into my own profession.
Right.
I all of a sudden, like aha moment, light bulb in my head, that it's more than the eyeballs. It's really the brain that we're talking about, and it's really a whole body and mind, and everything is controlled by the brain. And you need to nourish it. You need to understand what your brain is doing, because it's all about adaptation. It's all about the pattern you're running in your head. So holistically, we need the naturopath, we need the osteopath, we need massage therapists like yourself. So I'm definitely open, like even energy work or whatever, because we're there's so much I don't know. And that's why I'm on the path for, I'm forever student.
Right.
And I love it. I love
Right.
it, because the more things I know, the more things I realize I don't know.
Right.
And that's kind of scary.
Amen. And you know that we're on this Better Together mission here in Canada to bring conventional and complementary medical professionals together to put the patient at the
Yes.
center and to empower them with education and options for consideration so they can become the CEO of their health. We couldn't do that without partners like you. I want to thank you for coming on the show and for explaining to us, what not only vision therapy can do, but technology like Binovi can have. Tell us where we can go. It's eyecarrot.com for more
Yes.
information.
Eyecarrot, it is a company. They work with vision therapy doctors and their therapists. So if you need access to their devices, of course you need to go to these clinics.
Yes.
but they also have a platform where they actually can do coaching through the app via their app, but you have to be supervised by a vision therapist or your vision doc. So it's really, you need to connect with someone who will assess you functionally, visually,
Right.
so that you're visually fit, and then they recommend whether or not that is appropriate platform for you. But I feel they're collecting stats, which is very important for our profession, because many times people don't believe in what we're doing, but I've seen too many stories, success stories, to say that this is not working. And like you said earlier, I feel I am transforming lives. I am empowering my patients to be better student, to be a better worker, just to be better in life in general. You know?
Absolutely. I love the fact that, this technology, Binovi, is bringing this technology to our fingertips with coaching and professionals, healthcare
Yes.
professionals, to help you take control of your health and be monitored so that you can work better together. Dr. Ha,
Exactly.
I hope you'll come back on the show and do more with us. I know that you've got way more to share. And clearly, I need to think about some vision therapy.
Not saying a word.
Well, now, he didn't do the
I'm
test.
up next.
Yeah, I was
will
going
do
to
it
say,
next.
he
Off
didn't
camera,
do the
of
test.
course.
I took one for the team.
Yes, you
But,
did.
that's what we're all about here at Let's Just Do This. We're about empowering you to become the CEO of your health and to have a little fun while we do it. Well, from all of us here at Your TV, Mr. Todd Miller, myself, and the entire team here, until we see you next time, be well.